Mrs. Cross. It's Julie, and I'm here to have a listen to your breathing and see how you sound, and maybe need to suction you through the tracheostomy tube. Just going to wash my hands. Can you just state your name and date of birth? Okay, and do you have any allergies, Mrs. Cross? No? Good. Okay, I'm just going to get ready to suction through your trach tube. I've already assessed Mrs. Cross's lung sounds, and she does have scatterbronchi. Her pulse ox maybe is a little bit low. It's 91%, and she's been running about 95. And she also has a loose cough. Maybe she has some sputum coming out of her trach. So those are all indications that she needs to be suctioned. Her heart rate might be also be elevated. So I've already assessed that. I know that she needs to be suctioned. So I'm going to gather my supplies. And I need a suction kit, which I have right here, suction catheter kit. A size 14 French, which is good for mannequins. Could be 14 or sometimes 16 you might find in the hospital. I also have a bottle of saline, and I check and make sure that it's not outdated. I'm going to put the date and the time that I've opened this, and then after 24 hours you should have another new fresh bottle of saline. And also some clean gloves, a red bag in case I need to dispose anything in there. The other things that I'm going to need is the patient has oxygen going. She has a trach mask on, and that's set at 28% with this dial right here. So I'm going to leave that on her until I'm ready to suction her, but when I suction her, then I'm going to use the ambu bag. And this ambu bag is hooked to the second oxygen regulator. Obviously I don't have two in the actual pretend here, but there would be two connected together. So I would switch her over from that to the ambu bag. When I do use the ambu bag, it's to give a nice deep breath, and that helps loosen the secretions. It's the same theory as having a post-operative patient take deep breaths and cough. So helps loosen the secretions and also helps to oxygenate her so that when I do suction her, I'm depleting oxygen. So this helps to replace some of that. So I'm going to use that and turn that. It'll be here, and I'll be turning that right up to full volume. Up to 10-15 liters, so it's up to 100%, as close as you can get, of oxygen. And then last thing that I'm going to need is the suction equipment. This is the suction gauge, and I'm going to turn that to regular, not intermittent, and it would also be in the low area. So low, regular, continuous, or regular suction. And once I've turned that up, so I would turn that and turn this here, turn this to regular, turn this up to low, and then I can crimp that and just see where the needle goes to make sure that I'm not going to give her too much suction when I suction her. So that's already suction, and I've also got the ambu bag here, and that's already hooked up to oxygen, so that's ready to go. So I've got those three things. Tuck that under there for now. And I'm going to lower the bed rail. But before I do that, I'm just going to raise her head a little bit higher so that she's sitting up pretty good. Okay, so over here I'm going to, before I put my clean gloves on and give her a deep breath, I'm just going to open my suction kit. And on the very top of the suction kit, you'll see there's a box. A little paper box with plastic in it. The inside of that needs to remain sterile, and the outside is clean, so I can touch it with sterile gloves on. And you just pop it, and that makes it open up and stay open. So I'm going to leave this over here and take my saline, and I just want to lift the top of that, make sure it's good and clean, and then pour some of that into the cup. The purpose of the saline is to lubricate the tip of the catheter. When I insert it, helps lubricate it, and also flush the catheter after I'm done suctioning. So I'll put my saline over there. Okay, now what I'm going to do is put on my clean gloves before I touch that mask, which could have some bacteria on it, so I want to protect myself. And I'm going to take the mask off. Put that right down here. And then I'm going to put the ambu bag on the patient. This is the part that goes over the trach. And the patient can still breathe with the ambu bag on there. it's not occluding her breath. But now I'm going to tell the patient, okay, Mrs. Cross, I'm going to give you a deep breath with this ambu bag, so when you start breathing in, I'm going to squeeze the bag, and that's going to make you take a deeper breath. But I want to do it at the same time so that I'm not fighting against your breathing. So deep breath, squeeze. Okay, just going to wait another minute or two. Give her another deep breath. And if you had a second person, which often we do when we're doing this, suctioning the trach, the ambu bag could be on the other side, and your assist person could be giving the deep breaths while you're setting up the suction. Now, it's taken me a long time to do this, but when you're doing this in the real situation, it would be a lot quicker. So I'm taking off my gloves, my clean gloves, putting those there, and now I'm going to get my suction catheter ready. Now there's the suction catheter on top and my sterile gloves underneath. I want the sterile gloves. I don't want to touch that container that has the suction catheter in it because I want to keep that sterile. So I'm going to open up my gloves. And they look kind of all crinkled up and kind of a mess, but that's the way they look when you open them up. This isn't a fake kit, it's the real deal, so sometimes they come that way. Like I said, you could also grab your own pair of sterile gloves if this was not the size or you had a particular pair that you like to use. So I'm going to grab the inside of the cuff and insert my hand. Okay, and then I'm going to put my fingers, you can hold down one part of this if you need to. Put my fingers inside the second cuff and get my thumb out of the way so I don't contaminate it. And then apply my second. Okay, so now I've got my sterile gloves on. I can touch my catheter, which I want to remain sterile. Inside this container is the sterile catheter. I'm going to take that out. And then what I like to do is roll it up in my hand, like so, a couple times, like that. And then I can do this with one hand hooked to the suction catheter. Because now I'm going to contaminate this sterile hand. I want to give this patient one more deep breath before I go in and suction her. So first I'm going to hook this up. So now this hand is contaminated. So this is the clean hand and this is the sterile hand. Okay, and before I go in there and suction her, I just want to make sure it's working well. You see there's a vent there on top? When I put my thumb on that vent, it makes suction. So that's how you create the suction. So I'm going to test this. Remember I put some saline into this little cup here. So I'm going to make sure it's working. Working good. Then I'm going to wrap it up like so. Then I can hold that all in one hand like that. I'm going to give this patient another deep breath. Okay, Mrs. Cross, take a deep breath. Okay, and then I'm going to take my finger and put it on the faceplate of the trach so that it doesn't pull up on the faceplate when I'm taking off the ambu bag. Pull off that. And then I'm just going to put my ambu bag right down there because I'm going to use it afterwards. Unwind my suction catheter. I'm going to insert it without having suction, because I don't want to have to suction until I pull it out. So I'm going to insert into the trach, and usually you go until the patient starts to cough or gag, or you can feel resistance. It's usually about 4 to 5 inches. So now I'm going to start suctioning. As I'm suctioning, I'm going to intermittent suction and make kind of a circular motion. And see, I'm pulling the catheter through my hand, keeping my hand right there. Suctioning all the way out. Now, the first thing I want to do is give that patient a nice deep breath because I just sucked out all of her oxygen. Okay, flush my catheter. And then if I needed to, I would reassess the patient. Obviously I can't listen to her lung sounds because I want to keep this hand still sterile. but I just want to reassess her, see if she's still coughing, if still having sputum come up, then I may want to go and suction her again. Usually it's about 3 times passes that you're limited to suctioning, because otherwise you're going to create some respiratory distress for the patient. So if I needed to suction again, I could, but let's say that the patient sounds much better. Her pulse ox now is up to 94, 95. She's got a pulse ox on continuously, so that's how I do that. And I'm going to get rid of this suction catheter right into the bag, red bag. Replace the mask onto the patient. Okay, Mrs. Cross, I'll be back to check on you later. And put my supplies over here. Make sure that my oxygen is still at 28%. Turn off my suction. Okay, raise my side rail. Okay. And this concludes suctioning a patient through a trach.